So in general, this is more about ML, like machine learning and analytics that you were working on. How transferable are these methods that you develop or that people are actually developing out there? Typically in the research settings, there's limited data. It's like sandbox scenarios where you show that it works into real world scenarios, especially in healthcare. It's a little harder because the data availability and implementation and lives are at stake, literally, as I say. So how do you see in general on a journal in specific, making the transformation in healthcare sector?
So, no, it is absolutely essential that there should be a translation to real world decision making in the healthcare setting, and that it does require validation across multiple institutional settings, multiple data sets, different types of decision makers, and so on. So, but that's a huge undertaking, to make sure that, we're able to do this across so many different dimensions. And so as far as early research is concerned, the early piece of research may demonstrate, the potential of an ML algorithm constructed, as you mentioned, with limited data in a research setting, maybe in an outpatient setting, in an emergency setting, and so on. But you want to make sure that it's generalizable and it's scalable to actual decision-making settings. And that's absolutely key if you want to have an impact, for the proposed research. So, so from my experience, I find that the complexity of decision-making, in healthcare requires a deep understanding of the nuances of both the problem and the context in order to develop really strong methods. So when the focus is narrow, you're able to just dig deep into understanding the problem and the context, and hopefully that will make the methodology strong, scalable, generalizable, and so on. Then the next stage is to translate it, using extensive validation across all these settings and decisions. And I think that IJDS supports the spectrum by emphasizing that the problem needs to be really significant, important. Data has to be available. It could be synthetic, it could be simulated, it could be real, and strong, innovative, and generalizable methodologies to show implications, that insights can be derived from this process. And then scaling it up, could be the next step. But you need to have an outlet that allows this research, strong research, to be reviewed and published. And I think that's the opportunity that IJDS provides.
That's wonderful.